Hello, everyone. My name is Orquídea Gonzalez, and I'm currently an active student with ECPI University in the RN to BSN program. This educational PowerPoint is for the Nursing Course Community Health Lab. Overall goal of lesson. At the end of this lesson, the learner will understand the normal ranges of blood glucose levels, be able to monitor their own blood glucose levels, describe 3 signs and symptoms of hyperglycemia and hyperglycemia. Blood glucose ranges and treatments. For mild hypoglycemia, from 55 to 69 milligrams per deciliter, you can use the 15 to 15 rule. The first 15 stands for 15 grams of carbohydrates. This consists of 4 ounces of fruit juice or soda, 1 tablespoon of sugar, 1 piece of hard candy, jelly bean, or gumdrop, 3 to 4 glucose tablets, 1 dose of glucose gel, which is usually 1 tube. The other 15 stands for rechecking your blood sugar levels within 15 minutes. If your blood glucose continues to be low, you can repeat the 15-15 rule. For a severely low blood glucose level under 55 milligrams per deciliter, and the person is unable to swallow, you can use injectable glucagon, and it can be given to you with a prescription from your medical provider. After the injection, the person usually regains consciousness within 15 minutes. The glucagon injection may be repeated if the person does not wake up. Once alert and oriented, the person can have a fast-acting carbohydrate, such as a soda or a juice. After taking the fast-acting carbohydrates, you want to ensure that you also take a long-acting carbohydrate, such as crackers with cheese or a sandwich with meat, to ensure that your blood sugars level does not drop again once your body uses up the fast-acting carbohydrate. The American Diabetes Association recommend a target blood glucose level of 80 to 130 milligrams per deciliter. For hyperglycemia, greater than 120, it's considered hypoglycemia, greater than 126 milligrams per deciliter for a person who has not eaten in 8 hours. And it's also considered hypoglycemia if it's greater than 180 milligrams per deciliter for a person who just ate. Treatments for hypoglycemia that is greater than 180 milligrams per deciliter includes insulin. Long-acting insulin can help stabilize your blood sugar. However, you may need a fast-acting insulin with a sliding scale to help you decrease your blood sugar levels when it is too high. Diabetes medication help keep your blood glucose levels under control. Staying active can help stabilize your blood glucose levels. However, do not exercise when your ketones are in your urine because it can have an adverse effect that increases your blood glucose levels instead of decreasing it. A diabetic diet consists of small portions and avoiding foods and liquids that contain sugar. Equipment and supplies. What you will need to effectively monitor your blood glucose levels will be a glucometer, test strips, lancets, alcohol swabs, or if preferred, you can wash your hands with soap and water before checking your blood sugar levels. Where to buy equipment and supplies. Equipment and supplies can be purchased at CVS Pharmacy, Walmart, and Walgreens. On this slide, I have included a YouTube video that gives important information about test strips. Knowing where to buy your test strips is vital to ensure that they are up to date and compatible with your glucometer. How to check your blood glucose level. You want to start by washing your hands. Use a lancet on the side of your finger. Place a drop of blood on the strip and read the results. Every glucometer kit has instructions on how to care for your kit. Maintenance instructions may consist of keeping your glucometer kit in order, testing your meter regularly with a controlled solution, keeping extra batteries, storing your meters and supplies properly, such as avoiding the heat and humidity because it can damage your test strips, and replacing the bottle cap promptly after removing a test strip. Signs and symptoms of hypoglycemia and hyperglycemia. Hypoglycemia consists of hunger, irritability, trouble concentrating, fatigue, confusion, fast heartbeat, shaking, and headaches. For hyperglycemia, it consists of thirst, dry mouth, headache, frequent urination, blurry vision, nausea, confusion, and shortness of breath. Knowing the signs and symptoms of hypoglycemia and hyperglycemia is essential. Knowing the signs and symptoms can help prevent life-threatening conditions. Thank you for viewing the PowerPoint. For further information, please use the references listed on this slide. Thank you.